The News and Observer recently published an article about underfunded local health departments in North Carolina. One person who read the article and found it in some ways disheartening was Joe Coletti. He is a senior fellow at the John Locke Foundation. And Joe, you looked at this article and said it was an otherwise very compelling story, except for something within it that was disheartening. Tell us what your concern was.
That they got the numbers wrong, and kind of on a fundamental level. That when they're talking about underfunding of public health, and they take a look at what the public health department is getting, whether that's at the local level or at the state level or at the federal level, because we've seen the same complaint with the Centers for Disease Control and Prevention, the folks who are in charge of dealing with COVID and other communicable diseases. And the biggest portion of their money does not go to infectious diseases like viruses like COVID. It goes to at the state level, maternal health, women's and infants, nutrition supplements, a number of other things that are not directly pandemic related. And so, and at the state level, only 10% of the budget goes to pandemic type programs. The rest of it is for those women's, children's, AIDS, tuberculosis, things that are important, but not relevant in this context. And so it is really a shame when somebody says we're not dealing with COVID because local budgets and state budgets are not there and have been slashed, because they haven't been, especially not in this area.
So would it be safe to say that the picture is much different and health departments are in much better shape than the article would have presented? Yeah,
they are. It is a different picture. The public health departments are in better shape than presented, or if they're in bad shape, it is not because they've been cut in the last 5 to 10 years. It's because there may be some long-term underfunding that goes well back before that, and is a question of what was the concern, and because so many of these diseases have skipped over the U.S., right? You can understand why local governments and state government may have in the past underfunded those for a long period before the Republicans took over in state legislature, before President Trump took over in the White House, or any place else that people might be looking for blame.
So as the General Assembly is looking at COVID-19 relief or funding in general for these local health departments, they really need to keep the true figures in mind and not what they might have gleaned from this one newspaper article.
Yeah, definitely don't look at the headline numbers. If there is a shortage of public health nurses, otherwise that's going to be a much smaller expense than you might get a sense of from papers in the News and Observer and other sources.
Joseph Coletti is Senior Fellow at the John Locke Foundation. Thank you so much.
Thanks, Mitch.